Alice in Wonderland Syndrome, AIWS, also known as Todd syndrome or Lilliputian hallucinations, is a perceptual disorder characterized by distorted perceptions of one's body and the surrounding environment. The condition is named after Lewis Carroll's famous novel, Alice's Adventures in Wonderland, as the symptoms resemble the surreal experiences described by the story's protagonist, Alice. Individuals with AIWS may experience various perceptual distortions, including micropsia. Objects or body parts may appear smaller than their actual size. Macropsia. Objects or body parts may appear larger than their actual size. Metamorphopsia. Objects may appear to change shape or transform. Polopsia. Objects may appear closer than they actually are. Teleopsia. Objects may appear farther away than they actually are. Time distortion. Individuals may perceive time as either speeding up or slowing down. Auditory distortions. Sounds may be perceived as louder, softer, or distorted. Distortions in body image. Body parts may feel out of proportion or distorted. The exact cause of AIWS is not fully understood, but it is often associated with migraines and epilepsy. It can also occur as a result of viral infections, such as Epstein-Barr virus or the flu, as well as the use of certain medications or psychoactive substances. AIWS is most commonly reported in children and adolescents, but it can also occur in adults. While AIWS episodes can be disorienting and distressing, they are generally temporary and tend to resolve on their own. Managing the underlying condition, such as treating migraines or epilepsy, may help reduce the frequency and intensity of AIWS episodes. In some cases, medications used to manage migraines, such as anti-migraine drugs or anti-epileptic medications, may be prescribed to help alleviate symptoms. If someone experiences symptoms of AIWS, it is important to consult with a medical professional for a proper diagnosis and appropriate management.